Hello, my name is Dot Pugh. About 5 weeks ago, I became ill, and I went to the doctors and had some tests run, and I was thought to have ovarian cancer. But my Heavenly Father had other plans for me, and He used two of His earthly angels to help heal me, Dr. Alvarez and Dr. Marino. They were very instrumental in the healing process. After surgery, Dr. Alvarez came in the waiting room where my family was, and the first words out of his mouth were, "Amazing grace." So that has become my testimony now, and I would like to dedicate the song "Amazing Grace" to my Lord and Savior Jesus Christ, to Dr. Ronald Alvarez and Dr. Robert Marino.
Miss Sock, can you tell me about the events that took place on November 29th, 2012?
Yes, I was not feeling well. I was having trouble breathing. So I went to the emergency room and they performed some tests on me. And the doctor came in my room the next morning and just made the statement, well, it's back. And Tracy and I looked at each other, what's back? We had no idea what he was talking about. And he said, the ovarian cancer. Well, we had been told that it was benign, and so we were a little in shock that it was back.
So I stopped the doctor and said, do you realize you've just said something that she's never been told or heard before? And that's when the doctor stepped back and apologized and said, I'm so sorry. I thought you had surgery last year and knew it was cancer. They got it all and it was just back. So he started over explaining what the tests were showing.
How did you feel that the doctors and nurses handled explaining that mistake that had been made? Did you feel like there was someone, either a nurse or doctor, that particular doctor or maybe somebody else, that was available to answer your questions?
You talking about the mistake of calling it benign?
That when the doctor came in and said that they had missed something or that it was back, at that point I know that you were very shocked. Did you feel like, at that point you must have had a lot of questions. Was there somebody there to answer those questions, or did you feel like it was just expected for you to know, how to handle that situation?
No, they didn't really explain a whole lot of anything, and no one has ever admitted to a mistake. To this day, no one has ever said, well, I'm sorry, we, made a mistake, and it really was cancerous to begin with.
But we got it all.
But we got it all, No, they never said anything like that.
And I feel like even though, I was there when we got the news, and I feel like every nurse and doctor that came in after the doctor said that it's back, they all tiptoed around each other. Like, they'd walk in and like, do you know, or have you heard, or has anybody told you yet? Like they didn't want to allude that they didn't want to like share
Blame
something.
anybody.
Right, like, do you know? And so it's just this awkward atmosphere, like, well, yeah, we know, come on in, like, come talk to us and please explain, there was such shock on our face, and I'm sure that you could, cut the tension with a knife, but it was just really frustrating that people treated us like, do you know?
And it just showed a lack of communication on the healthcare professional side. Obviously that should have been dealt with, and, physicians and nurses should have all been on the same page with that. And
Some kind of follow-up, if that doctor thought we needed that and saying it's back, there should have been some kind of follow-up to begin with instead of saying I'll see you in a year.
right.
So to me that was kind of disheartening, and they called me, and I'm still thinking, I was still in shock. So
Okay, Ms. Stott, allowing the client to be at the center of their own care is a big initiative that the healthcare system is striving towards. Did you feel like your healthcare providers were being honest with you throughout your care? And also, how important is it to you to be included in all aspects of your care when you're in the hospital, such as when planning and treatment decisions are being made?
I think it's very important to be in on all the decisions and everything. What was the first part of that?
Did you feel like your doctors were being honest with you throughout your care? Did you feel like as the process went on, it seemed that certain things were being withheld, especially with doctors coming back in, when y'all did find out that the cancer was back, I guess, do you feel like information had been withheld from you, like maybe decisions had been made to does that make sense?
Yeah, I don't feel like they were being totally honest. I don't know. I don't understand it. I don't know why. I think they were probably embarrassed that this had been overlooked or what, but but I do not feel like they were being honest with me.
But then when, you know, we knew what it was and you got in touch with the medical oncologist, he was up front with you
Yes.
on all things.
This was Birmingham that was not honest, but my doctor here in Opelika has been truthful and very informative and just has answered any question I've had.
You know, well, even, you know, you said every time I talked to you on the phone, Mom, that, you know, you felt like something, you know, I'd say, how's Mimi today? Well, I just don't feel like they're telling us everything, or I just feel like there's something greater that's going on that we're not being told. I feel like they're not running enough tests. I feel like, you know, when she's saying it's her back, they're thinking it's her head. When she's saying it's her nose, they're thinking it's her toe. You know, like, just...
Well, she was just showing signs of sickness
Progressing.
and progressing each hour. She just would, you know, keep turning for the worse, and we just couldn't understand why we weren't getting better. You know, so, you know, we know we
It
have
is what it
cancer.
is.
Okay, well, let's treat it, but why are we so sick? What is going on with her to keep her this sick, you know?
And since her question had to do with withholding information, I realized that you were able to have access with the doctor to information from last year's chart from Birmingham. Kind of explain, like, what you found out, what your reaction was to that.
Yeah. When, being that I work in the cancer center and I am familiar with the doctors, I went to the particular doctor and I said, you know, now that we know what it is, I said, what did the actual report say from Birmingham? And since he has access to be able to pull those up, he looked him up and he said, well, you know, it all says benign, but, you know, when it's such a large tumor, you know, there needs to be some kind of follow-up, because normally if it's that large and it was necrotic, so it's kind of hard to get a pathology really from something that's a dead tissue. So he said, you know, the size and the way it was should have been followed, because, you know, her number was elevated, but nobody even checked it after the fact. But the reports originally said, you know, she had this big mass in her abdomen and she had bilateral pleural effusions. So all that to say, she already had the fluid around her lungs then. And at this point, you know, she's gone now a year short of breath to a certain extent. Now, this was extreme, but knowing all the disease processes, that they were already there in place, making the fluid.
Right.
Completely withheld from us.
Withheld from us. None of that
So we've gone a whole year without any kind of
knowledge
knowledge
about
or treatment.
that particular thing,
Right.
you know.
And if you had been included in that, you might have made decisions to take care. I mean, you know,
to make follow-up
right, to make follow-up
appointments
visits.
ourselves if
Right.
we thought, you know, well, reading, you know, it's always hindsight.
Right.
But reading now to the information of ovarian cancer, when it's an advanced stage, you have bilateral pleural effusions.
Right.
That's one of the things that it says. So even then, why didn't somebody say, we ought to just do a CAT scan, or we ought to just do a different test to assure us that it is gone? Mm-hmm. You know, or a follow-up in 2 months. Well, they may clear up after they've got the big mass out of the belly. And that's kind of what they told us, that once we do that, because I even asked about a PET scan. You know, should we just check the whole body, you know, just to make sure? And they're like, no, because once we got the, you know, the big mass, the pleural effusions and the fluid from her belly will go away. And, you know, I guess it did to some extent, but still not enough. Mm-hmm. So, I mean, that's very disheartening when it comes to information that we thought was withheld.
Right.
Or nobody addressed, and we didn't know to address until after the fact.
Right.
So really, we spent a whole year going back and forth to the doctor trying to find something that was causing her to feel bad, and nobody could,
Yeah.
you know, nobody had an answer.
Miss Tracy, after Miss Stott was discharged from the hospital, she needed home care. Did you feel like her doctors and nurses prepared both her and your family for that process? Were they helpful in that transition?
I believe so. They did ask what all aids we had at home to help ease the transition, from the hospital to home, I felt like that home care didn't get out here soon enough, and really meet us when we first came home. It was several days, but it was around the holidays. But, we did have a social worker come in and ask, how can I help connect you with home care and get the information right? So,
And even when we got here, like it had been kind of planning in the making. I had heard things and been contacted by people, and a few days after we got home, or maybe it was weeks, I don't know. The community built a deck outside and a wheelchair ramp, so it made it easier access for you to get in and out of the car to go to doctor's appointments and wheelchairs, and so that you didn't have to climb slippery steps, and just made it. There was a community effort, to really participate in our care. People bringing food and stuff. So it was an easier transition to home, even though we really needed more of a hospital care sometimes. We were able to come up with the resources here.
Lots of good helpers.
Ms. Dodd, I know that the past few months have been really difficult for both you and your family. Can you tell me more about the behaviors of your nurses or doctors that you and your family found particularly upsetting? In other words, did you feel like the team of healthcare professionals let you down in any way, or in contrast, did they meet your expectations?
I would say probably, I'm going to go 85% were just superior. There was a few that were lacking and just didn't seem to care, and a few of them that didn't really listen to me, but the majority of them were just great.
And I know, I can hear you as the client in this situation saying just that it's important for healthcare providers to listen to the patient. And that goes back to, patient-centered care, and that, you should be very involved in your treatment. And
Well, I have something to say also about that, because being that this information hit us out of the blue, there were several days and weeks that we went without anybody really looking to our emotional needs, because this is not like we were making an appointment with a doctor just to go see why we feel bad, and then in a couple of weeks we find out what we got. We were very sick and having to be in the hospital, and trying to do the tests that needed to be performed to find out what was wrong. And then we were told and that it was back, and we had no idea what was back, but we still trying to process all that information of the thought of cancer, and my mom's so sick, and what do we do? I don't know that we really had many nurses or doctors look into our emotional needs, to really, let's talk about what you've just heard. What do you think, and how are you feeling about that?
And of course, we all had each other, and being from here, we had a lot of people come by, and so, we were able to express emotion, just because we're such a close family.
That's right.
And, so that, there wasn't like, I didn't feel like I had anybody to talk to. There's always somebody there, but I feel like, just even being a part of the system, things are so day to day, things get so busy, and like we're trying to take care of everything that we can treat on a patient, but the emotional side is what we forget, and sometimes that is the most important side, especially in something like a chronic illness like cancer. There's a lot of emotions there, maybe more than a lot of other diagnoses.
And everybody said, do you need anything? Well,
We didn't know
what we needed.
Right.
And so sometimes one nurse in the middle of the night just lovingly said to her, well, this is hard on you. You just found out about this, and it's a tough place to be, and then we felt like
Somebody listen.
we could,
Yeah, we could pour our heart to them.
we, we could say something that we were feeling, and,
another example, I was the only one in the room at this time. I was working at the hospital, come down just to pay a friendly visit. My mom and aunt weren't there because, they'd been there for 24 hours, just a long time. And so they went to take a break. And I came in there just to say, hey, well, the doctor comes in and is like, oh, tomorrow we're going to do a retrograde cholecystectomy, blah, 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 blah. Big words. All right, see you later. And I just remember the look on Mimi's face like, what am I having done tomorrow? Do I want this? Is this gonna help me? Like, after procedure after procedure after procedure, let's start this IV, let's pull this tube, let's do this. Another surgery, we were like, do we even need this surgery? What is this like? And nobody was there, and so he just left, and there was such a lack of communication. I had to go do research on my own to figure out so I could tell her what that surgery was gonna do for her. Like, it just...
There wasn't one central location that the information was coming from. So we were having different specialists come in and tell us their specialty and what you need, but getting the whole big picture.
There wasn't a lot of team effort. It was just bits and pieces.
And then
we were kind of having to piece them.
So we're putting together what she knows from working in a cancer center and what the internet tells us and what you as a nurse in nursing school's learning and, how we see how she feels. And
And thank goodness, being that I do work in the cancer center and the doctors that are taking care of her, I go to my nurse and her nurse and say, look, I really think she does need something emotionally. I mean, she has heard all this, stuff. And so immediately they're like, that's great. We'll start her on this. I think this will, help her.
I'm interested, and we've kind of talked a little bit about it, but how did you feel like your family was treated during Miss Dot's time in the hospital? Did you feel like, did you feel like your questions were addressed, or that, just like you said, I guess it shows how important, even when you're in the hospital, there are a lot of physical needs that need to be met, but it's just as important for both the patient and the family for your emotional needs to be met. And in that position, you have so many questions. I guess just kind of elaborate on how you felt as a family. I know it was just a really scary time.
Being that when she was in Birmingham and she was so sick, right after we had just found out, and she wanted to go see her doctor, in Birmingham, I think they did kind of skirt around some of the questions we asked. I mean, nobody really gave us any information, and we kept asking, well, what about the test that we had run at Opelika? Can that not help you? And they just keep saying, well, we don't have that information. We don't have that information. And, not until I call home to get that information sent up there, and they're still not telling us the results of that. But while we were there, nobody really addressed our questions that we asked. One time, Tracy asked the doctor, I don't know if Mom was asleep.
she wasn't in the room. It was just me and Christy, and he was headed out the door.
Yeah.
And I just point blank asked him,
what are we up against?
What are we up against? Because nobody had said.
Nobody's, at that point.
They were not really telling us a stage that her cancer was in, even though what we were reading on the internet.
We knew what it was.
And we knew what she had. She was too sick to just be a stage 1 or a stage 2. And I just point blank asked him, how long is this, are we going to have my mom around? Because she is so sick, and we just don't understand why she has gotten to this point, So I just asked him point blank, tell me what we're up against. But he
skirted around it as well.
He
And
still
he kind of
skirted
said, well,
around.
I have a lady that I treated that was
the same 9 years.
9 years. We could be saying anywhere from 3 years, 9 years, 13 years. He still really never wanted to answer that question. Mm-hmm. And that's as I would say, a 1-800-HEAVEN, our doctor that I used to work for. He said, that's a 1-800-HEAVEN question. Mm-hmm. Nobody can answer that. And we understood that part of it as well, being that, working in it, being around it,
But that's his job to tell
give
us
some
as a family,
Or even say, I really
Don't
do not know.
know.
Like, be
Yeah.
honest.
Honest about
Be
everything.
honest. Communicate everything. Because that's the only way we would know what direction to go. Should we even treat her with chemo if she's not going to make it past the chest tube procedure? I mean, we really were stuck in limbo with all of that.
We're constantly begging for honesty.
Yeah.
Like, we know this is bad. Tell us how bad. Tell us details. Give us big words and explain those big words. Don't not tell us the big words because you don't think that because we weren't in healthcare that we don't understand and those big words scare us. We're like, give it to us all.
That's right.
Just
We'll write it
we'll
down
deal
and-
with it. And
But to me, in my opinion, the knowledgeable patients and their family have the doctors have the hardest time dealing with them. Because even though they know you kind of know, they don't want to give you everything. They feel like that you will know more than them at that point. And I have seen that as well. You know, but the truth is much better than anything else. You know, if this happened a year and a half, in October of 2011, if they said, you know what, this is ovarian cancer and we got it all, or we think we got it all, even though this is benign, you know, in a year later when she's so sick, in our mind, we would have been thinking, you know, I bet it may have came back. We would have all been thinking that if we'd have been told that up front. So it still goes back to honesty.
Right.
You know.
Were there any healthcare professionals that were especially supportive of you and your family during this time? If so, what qualities did he or she exhibit that made you feel like you could trust them?
There were several nurses that were just precious. They were really interested in how I felt. They were interested in my family's comfort. They really made it.
They listen to your pain, listen to your needs.
An easier stay than what it could have been. And nurses play such an important part in your stay at the hospital because they're the ones that you see all day. And I appreciate what they did.
Right. And I guess going further, and we kind of addressed this, what actions did they take that let you know they were genuinely concerned about their emotional needs as well as your physical needs related to treatment? And I know, just because I've gotten to talk to Morgan some, that there were some nurses that went out of their way to let you know that they cared not about just about your physical needs, but how you were doing and how you were feeling, and wanted to, come and see you when they weren't working, and tell me about how that impacted you, and just, how it made you feel emotionally, how, when you're so sick and when you're in that condition, how much it meant for somebody to come and just see how you were doing.
Well, I really couldn't believe how much they did that. There was probably over half the nurses that would come back and see me before they left to go off their shift. And one of the nurses went to Ma Stories and got me a peanut butter milkshake after she got off work and brought it back to me.
And she's not going to say this, but she's a blessing to everyone she meets.
Oh.
And you can tell that from the minute you walk into the room with her.
Right.
And they knew that as well.
Can you tell me, has your view of the healthcare system changed as a result of your treatment experience? I know a lot of, questions. It raised a lot of questions, but did you feel like that changed the way you saw healthcare and even trusted your healthcare providers? Were you able, looking back at it now, do you feel like you're still able to trust that system?
Yes, within reason, as long as my committee is there. Yes, we've learned a lot through all this. And I don't know what I would have done without them. I wouldn't have done. But,
We learned how important it is to ask questions, ask detailed questions,
Yes.
do your own research, consult resources that you have. It's not bad to use resources. You know, there wasn't anything that any of us did out of our scope of practice or anybody that we talked to, you know, that we weren't allowed to. You know, like, it just so important to use everything you've got to get that whole collaborative care. Like, and I feel, you know, like someday we'll be nurses, but we can't do it on our own. That's the whole, you know, we've reinforced collaboration between each healthcare member. You know, nurses can't do it all, doctors can't do it all, physical therapists can't do it all. And it was just important to see, you know, and saying that, the healthcare team can't do it without the family. You know, like, information would not have been given to the doctors, you know, without the committee being there 24/7.
yeah.
That's the most
24/7.
important thing, is to have somebody there, you know. And she was okay at sometimes to tell them exactly how she felt, but then there were times as well that she couldn't have thought really through the process to tell them how she was feeling or what she needed, you know. And at
Or
2
couldn't
o'clock
even
in the
feel
morning,
good enough
or
to
did-
tell them how she felt.
that's right, that's right.
And I think, I mean, just what you said, I think that that's such a learning lesson, you know, especially to, you know, new nurses that are going into the field, you know, to realize that we need to encourage our patients to ask questions, you know, that, you know, and provide them, you know, with as much information as we are able to, because you do need to be a part of your care. Nobody knows your body like you do, you know,
That's
and
very important. I totally agree, because, you know, even working in the system, and I feel like the system works, but then, you know, you're looking at your mom that's been so sick for so long, it makes you doubt the system. But truly, the only way the system works is to tell the truth to your doctor, to your nurse, to whoever's taking care of you, because they're really not going to get the whole picture, and the doctor really can't take care of you the way you need to be taken care of unless you tell them exactly how you feel.